Good morning. Thank you for joining us for a press briefing on the release of Yale University's study, COVID-19 Transmission in U.S. Childcare Programs. My name is Wes Battles, and I will be moderating this morning's press conference. Yale has completed a months-long study on the relationship between COVID-19 and childcare in the first 3 months of the outbreak, studying the characteristics of individual childcare centers, their mitigation efforts, and the impact of community-level transmission. This study, published today by the American Academy of Pediatrics, is the most comprehensive such study to date, looking at more than 57,000 childcare centers across all 50 states, Washington, D.C., and Puerto Rico, representing over 71% of Americans' counties. You can find the study's findings, a full report, and additional resources at childcareaware.org/Yale, and also on the American Academy of Pediatrics website at aappublications.org on the link on the screen and also linked in the Zoom chat. For more information or to inquire about additional interviews with our participants, please contact me at wbattle@craftdc.com or my phone number on the screen. So what to expect this morning? We're going to hear from Dr. Walter Gilliam, the lead author from Yale University who led this study, and also from Dr. Lynette Fraga, the CEO of Childcare of America, who are making some key recommendations for childcare as a result of this survey. Next, I will moderate a conversation between Dr. Gilliam and Dr. Fraga before taking some questions from the media. We'll wrap up by a few minutes before 10 a.m. Please use the Zoom chat feature at the bottom of your screen, identifying your media outlet, name, and question. Without further ado, I'd like to introduce our first presenter this morning, Dr. Walter S. Gilliam, the Elizabeth Mears and House Jamieson Professor of Child Psychiatry and Psychology at the Yale University Child Study Center. Dr. Gilliam's research involves early childhood education and intervention policy analysis, ways to improve the quality of pre-K and child care services, the impact of early childhood education programs on children's school readiness. He is also the president of the board for Childcare of America. Please welcome Dr. Gilliam.
Thank you very much, Wes, and good morning, everybody. This is the largest study of COVID-19 transmission in childcare programs that's been attempted in the United States and I think globally. And in fact, it was easy to be the largest at 57,000 because it's pretty much the only one that's actually been attempting to actually track the actual transmission rate and whether or not, making comparisons to be able to see whether or not the childcare program itself might have been causal to whether anybody in the program contracted COVID-19. So what we did was we started this study in May 22nd, and ran a survey to 57,335 childcare providers who responded nationwide. And as Wes said, this was a very broad sample of childcare providers. They're home-based providers as well as center-based providers. These were the individual people who are working directly with the children and coming into contact with children on a regular basis. And they're from 71% of the nation's 3,100 counties. And so we have pretty wide dispersion of these childcare providers that were in the sample. Now, at the beginning of the pandemic, about half of the childcare providers in our sample closed. Their programs shut down and they closed, or their programs might have remained open, but the provider didn't go into work because the provider decided to stay home or work from home or to not work during the pandemic. But the other half or close to half of the providers did go into work. And what that did was it gave us a perfect opportunity to be able to compare the experiences regarding COVID-19 of the childcare providers who went to work versus the childcare providers who didn't go to work. In other words, the childcare providers who were exposed to children in childcare versus the providers who were not. And so when we surveyed these providers, we did so with an epidemiological survey that was constructed by my team of epidemiologists and viral infection disease docs at Yale. And we asked them lots of questions about comorbid conditions, and we asked them about gender, race, and ethnicity. And we asked them questions about their amount of contact with children in childcare. Did you go to work? When did your program close? Did your program stay open? How much contact did you have with children in childcare? And we also asked them questions about their COVID-19 status. Did you ever get tested for COVID-19? Were you ever lab confirmed positive for COVID-19? Were you ever diagnosed with COVID-19 because you were hospitalized for COVID-19? And we also asked questions about how they were trying to protect themselves at home. Were they wearing masks in their home life apart from their work life? And were they maintaining social distance? And were they canceling riskier kinds of events where they might be more likely to contract COVID? Since we had so many counties represented in this data set, it allowed us to also be able to control for background transmission of COVID-19, the amount of COVID that was in their community, by taking this massive data set that we had and merging it with the massive Johns Hopkins University COVID-19 transmission data set, using things specific to how many people in that community had died due to COVID-19 as a proxy for the amount of COVID-19 in the community. And so, cutting to the chase, what we found was analyzing the data in a variety of different ways to make sure that we were coming up with a consistent picture, is that we found that there was really absolutely no relationship whatsoever between going to and working in a child care program and COVID-19 status. No relationship. COVID-19 did not put these providers at any increased risk of contracting COVID-19 than if they had stayed at home. And that's an important finding in large part because if there's anyone in a child care program that's more likely to show the effects of COVID-19, it is the adults. Children tend to mask over the symptoms of adults of COVID-19, and so the adults are the better measuring stick for COVID-19 transmission. And even with these adults, we did not find any relationship whatsoever between exposure to childcare and if they had no exposure to childcare. Now, there's a few caveats that are worth bearing in mind. One, childcare providers did get sick. 427 of the childcare providers in the study reported testing positive for COVID-19 or being hospitalized. However, their likelihood of getting sick had no relationship whatsoever to whether or not they were working or staying at home. We also know that our Black, Brown, and Native American childcare providers were more likely to report COVID-19 illnesses. But even with them, their illness was unrelated to whether or not they went to work or didn't go to work. Home-based providers were a little bit more likely to report COVID-19 sickness as compared to center-based providers, but also for them, it was unrelated to whether or not they were providing care or if they had shut their program down completely. And so what I want to emphasize in this is that this doesn't mean that people don't get sick. It just means that they were getting sick for reasons that were unrelated to whether or not they were providing childcare, whether or not they were being exposed to children in childcare. But we also have to realize that this is within a context. These childcare providers were doing incredible things in order to try to reduce the likelihood of illness. They were operating with group sizes about half of what they would typically do. About 3/4 of them were doing daily symptom screenings and temperature checks on everybody who walked in the door. About a third of them were doing that twice a day, checking for symptoms. That's not a normal, typical thing that we typically do in childcare programs. Over half of them were reporting disinfecting literally every surface and every fixture in the program 3 or more times a day. And then on top of that, also, keeping children in small groups and keeping those groups together, not having those groups mix with other groups and things like that. And so it's important to realize that their success is probably related to a lot of the things that they were attempting to do in order to keep those children safe in their program. And the other thing that's worth highlighting too is that childcare providers in communities with higher COVID transmission rates were more likely to get sick. But again, that illness, that sickness was not related to the program, and where they went to work, it was related to conditions within their community. And so the recommendations that we would make from something like this is, one, childcare programs can be reopened and can be reopened safely. But one, just because childcare doesn't seem to pose a threat to communities in terms of community spread, that doesn't mean that communities can't pose a threat to childcare. And so communities need to be able to do the things that they need to do to keep the COVID-19 threat as low as possible within the community. And we need to also make sure that our childcare providers have the supplies and the supports that they need in order to be able to keep COVID-19 out of the front door through symptom checking and symptom screening and things like that, and also to be able to reduce the likelihood of spread within the programs. And so with that, I'll hand it back over to you, Wes.
Thank you, Dr. Gilliam. Next, we have Dr. Lynette M Fraga, the Chief Executive Officer of Childcare Aware of America. Dr. Fraga is a passionate practitioner, advocate, and leader in the field of childcare. She has 25 years of experience as an educator, program director, and executive leader working on behalf of children and families. She began her career in early childhood as a teacher in infant, toddler, and preschool classrooms. Dr. Fraga, based upon this important study, please share with us Childcare Aware of America's recommendations.
Thank you, Wes, and thank you so very much, Dr. Gilliam, for this study. It is so critical. The Childcare Aware of America dug into its findings, and we know there are implications for our nation's economic recovery and for parents and providers and policymakers. So simply put, no childcare, there can be no economic recovery as parents and employers and communities rely on this critical infrastructure to get to work and get the economy running. The study is critical as we seek to support parents. And it's critical because of what we're hearing from parents, like Kate in Oregon. She was at a child care center. Her children were at a child care center that was closed due to the pandemic. So she enrolls her two young children in another program in the area. And unfortunately, that program also closed permanently. And now Kate, like many parents, are scrambling for child care for her children so she can continue to work. And Kate's story is far from unique. Across the nation, families are under increased pressure due to disruptions in child care. We know that when children are exposed to high levels of stress over time, it can undermine their ability to learn and thrive for the long term. We need to have a greater sense of urgency around solving the problems that are adding stress for families. We also know that young children need social interaction in a stimulating environment to keep learning and growing and thriving. Early childhood providers play an important role in establishing a foundation that will last a lifetime. We need to make sure that this essential sector remains viable. Indeed, parents across the country are asking, is it safe to send my child back to childcare? To do right by children and families now and through the recovery, we can't ignore the essential role of the childcare sector. And it's also critical, of course, because of providers. The study found safety measures as effective, but providers need help paying for them. Here, childcare providers were among the first to respond with a plan that kept infection rates down, playing a central role in communities across the country. It's a clear illustration of how effective providers have been throughout the pandemic in preventing mass spreading and outbreaks and providing healthy spaces for children. Providers have taken tangible, proven steps like disinfecting and cleaning multiple times a day, hand washing and symptom screening in small isolated groups of children, and wearing personal protective equipment. Enhancing and strengthening health and safety measures has increased costs for providers. Equipment costs money, however. Sanitizing costs money, and the smaller group sizes require more staff who need to be paid. Many childcare providers were already operating on such very slim margins before the pandemic. The viability of this essential sector is now at risk because revenues are down, fewer children attending means less tuition, yet expenses are up. They now face substantial revenue reductions due to COVID-19 group limits because most of their income comes from tuition fees. Every day we're hearing from childcare providers like Lisa in Mississippi who has kept her doors open throughout the pandemic. In the first few weeks of the pandemic, revenue plummeted as enrollment dropped from 360 children to only 56 children. Now enrollment is up again, but Lisa told us her expenses are way up too. From cleaning supplies to additional staff to handle smaller group sizes for the children. She doesn't want to raise tuition rates because families may not be able to afford it, and she's very worried that her center may not make it, and we should be worried about that too. It's also critical for the policy change. Robust relief is needed. There are real steps policymakers can take to be responsive to this study and to the experiences of parents and providers that I've shared. First, Congress has to approve stabilization funding for childcare. We need state and local officials to make evidence-based decisions about whether or not childcare is open. And we need all policymakers to support policies that care for childcare providers so that they can safely care for our children. First, everything we've learned through this study points to the need for additional investment in childcare. As this study showed, in some communities, it may be safe to open childcare with significant investment and considerable mitigation efforts. In other communities, while childcare may not be responsible for the spread of COVID, background transmission may require ongoing or variable closures. Both scenarios demand investment to stabilize the child care sector. Congress must provide at least $50 billion in child care stabilization funding. Without this robust relief, child care providers may permanently close. And I'll repeat what I said earlier. Without child care, there can be no economic recovery as parents, employers, and communities rely on this critical infrastructure. In addition, even with additional investment in childcare, local and state policymakers will have to make tough and ongoing decisions to open or close childcare. This study shows that background transmission rates matter. So these local decisions must consider the public health guidance and be developed with deliberate, resourced input from all stakeholders, including the child care system. And finally, I say to all policymakers, obligation to children involves a responsibility to keep the adults who care for them safe. This means providing health care coverage, unemployment insurance, and paid sick leave for child care workers. And we must prioritize healthcare access and regular free COVID-19 testing and future vaccine access for child care providers. So in summary, no child care, no recovery. This we know is clear. To keep the vital sector of childcare open and viable, providers need help so they can continue to implement the enhanced health and safety measures. Community must consider background transmission rates when making decisions about childcare. There is just no doubt. Congress must provide $50 billion in childcare stabilization funding, and soon. If childcare centers close their doors, we lose a critical piece of our economy's infrastructure, not to mention putting providers out of work. Delaying stabilization funding doesn't just postpone our economic recovery, it makes it harder. We need swift action, and we need that action now.
Thank you, Dr. Fraga. I'm now going to moderate a brief conversation with Dr. Gilliam and Dr. Fraga. And for our media, if you have questions, please chat me in the Zoom chat, and I will call on you after several questions. So Dr. Gilliam, you and your team of Yale researchers have produced the largest study of child care providers in the country. But for everyone to understand, bottom line, does the data indicate that it is safe for parents to send children to child care? Do I have that right?
Well, how I would interpret this is that these are very positive findings, and they should be very comforting findings. As I said before, if there's ever a good measuring stick for COVID transmission within childcare programs, it actually is the adults. Children tend to mask over the symptoms more than adults, and so it becomes harder to detect it with the children than it is with the adults. So the adults give us a low bar threshold for detecting it. And even when we were looking at adults who were exposed to high levels of childcare versus low levels of childcare, we found no transmission differences between those. And so I would take that as a comforting finding, but it needs to again be within the caveats that we've set before. That's a comforting finding if transmission rates are reasonably low within your community. You're not in a hot pocket of COVID transmission, and also if your program is comfortable being able to implement the mitigational strategies that they need to be implementing in order to keep themselves safe, that they have access to the supplies and the supports in order to be able to operate safely. And if those things are in place, I would take this as incredibly comforting news regarding childcare as a safe place for children and families.
Dr. Fraga, same question to you. What are you hearing from childcare providers? Are they able to operate safely? And what else do they need?
They need so much. They need so much support. What is so clear is that, it's evident in the study, that these mitigation activities like cleaning supplies and sanitation and smaller group sizes and so forth, what really is needed from for providers is the resources and supports in order to do their work. They really have done such a Herculean, heroic effort in supporting children and families, but they need the resources in order to access the personal protective equipment, access the sanitizing equipment, access the training and education needed to provide safe spaces for kids and families. That's what providers need. They're concerned about keeping themselves safe and keeping the children in their care safe, keeping their own families safe. But with resources and support and investment, childcare providers can provide the kind of care that they want for children and families.
Thank you. Dr. Gilliam, your study appears to be great news for childcare professionals, but what can you tell us about the children themselves?
We unfortunately weren't able to collect information regarding the children, and the main reason why is just logistically it would have been nearly impossible to have quickly collected information on children who are attending childcare programs compared to those who are demographically similar who weren't, because it would have been difficult to actually find those children. But going back to what I was saying before, if you have a choice between the better measuring stick for the likely transmission of COVID-19 in a childcare program or any other setting, it is the adults who are more likely to actually show the symptoms of it. And so although we can't actually say that we know from this particular study of what the exact rates are within the children, I would take this as positive findings nonetheless. However, I should say that, at the beginning of the pandemic, about half of these programs closed and about half of these programs stayed open. And of the programs that stayed open, about 9% of them later on did have to close because of a COVID-19 suspected case. But again, that suspected case seemed to have nothing to do with the programs and much more to do with the community itself.
Thank you. And I've got a question here from Sonia Sharp from the Los Angeles Times. For you, Dr. Gilliam, do you know the average age of the kids in the program in the study?
Yeah, I can't tell you right off the top of my head the exact average, but I can tell you this. 81% of the children that were being cared for by these providers were under the age of 6. So overwhelmingly, these are young children. Most of them were preschool age 3 and 4-year-olds, followed by toddlers. And so they were typically much younger children. And in aggregate, the number of children who are served by these 58,000 is just under 4 million children. So there's about 4 million, infection opportunities, I suppose, for these childcare providers.
Her follow-up question was, if the majority are under 6 or preschool age, as you indicate, how much can we extrapolate from the study about the potential safety of school and or group childcare for older children?
Excellent question. I would be incredibly cautious about doing that for 2 reasons, and I'll give you the smaller one first. One reason is that most of the evidence suggests that young children, even though they can transmit it, don't tend to transmit it as effectively as older people do. There's this one study that just recently came out of India, but with the exception of that, most of the science suggests that young children just don't transmit it as much. And many of the pediatric infectious disease docs that I've been talking to think that it basically mostly boils down to just transmission mechanics. Young children expel less COVID into the air because they expel less air. And so as a result of that, they just aren't as likely to fill up a room and fill up the space with a lot of COVID material as much older children or adults are likely to do. But I honestly think that the difference is the bigger, it has to do with the context, much more so than the size of the children. Childcare programs are uniquely situated, and Dr. Fraga can say more about this in a minute, to being able to be incredibly vigilant on health and safety issues. They're licensed primarily regarding issues having to do with health and safety. And in schools, not really so much. Also, when you're talking about childcare programs, group sizes tend to be smaller than class sizes in elementary school, middle school, and high school. And during the pandemic, especially the first 3 months of them, those group sizes were smaller yet. On average, about 6 or 8 children in a group, which is about half of what you would typically see pre-pandemic period, especially for preschool age children. And on top of that, in childcare programs, you actually can, what they call cohort, keep a small group together and not have it intermingle with other groups. But that's really not very possible in middle school and high school. Middle school and high school, pretty much every hour, you have a larger group of kids who then congregate in a hallway and then go reestablish themselves in a completely different group of other kids. And so as a result, in middle school and high school, the amount of social contacts that children have with other children is immensely higher than what you would see in a childcare program. And so I would try to avoid extrapolating from this for those 2 reasons. The smaller reason probably being because of the smaller size of the children, but the much bigger reason having to do with the vast difference in the context between childcare programs that are able to implement a lot of these mitigational techniques and schools that by design will probably struggle a lot more with them.
And Dr. Fraga, maybe you could talk a little bit more about some of the mitigation efforts that you're recommending that child care centers, continue or expand to use.
So the mitigation strategies that were articulated in the study, I think, are incredibly important. And again, I will just raise up how child care providers have just done a tremendous job throughout the pandemic. Those that have been able to stay open in trying to balance the care and nurturing of children at the same time that they're trying to ensure the kinds of heroic mitigation strategies and sanitizing strategies that Dr. Gilliam's study outlines. What they really need as they're moving through things like taking temperatures and having smaller group sizes and keeping cohorts together and sanitizing multiple times a day is the additional resources that takes to do those kinds of things, both accessing the kinds of sanitation and personal protective equipment that's needed, but also making sure they have the training and technical assistance and support and education to know what to do through COVID. As a licensed child care provider, licensed providers get a significant amount of health and safety training. So in that way, they were prepared. Infectious diseases and preventing infectious diseases is something that licensed child care providers are trained on. But the additional, of course, stress and challenges of a global pandemic, of course, are going to increase their need to do things like keeping their children safe and healthy and themselves safe and healthy. So I really do recommend that in order to keep the kinds of mitigation strategies in play that Dr. Gilliam's study reflects, it's really necessary for us to ensure investment at $50 billion to not only stabilize, even more money to really ensure there is an investment in our children and their health and safety so that our communities can get back to work.
And Dr. Fraga, what would happen if child care providers do not get this type of assistance? What are you hearing? What is the financial health of our child care providers?
Providers are worried, and parents are worried because providers are worried. Providers are worried because they know that there is expense associated, and they've experienced the expense associated with the kinds of mitigation efforts that are needed. And because of the expense and because of the necessity of all of the health and safety requirements and recommendations, and because providers were already operating prior to the pandemic with incredibly slim margins, providers are worried about whether or not they can even stay open. Those providers that are open are worried about that. And parents are, of course, worried about whether or not there's going to be a childcare system and a childcare program to put their children in. So these are both incredibly significant worries. We're seeing that between 30 and 50%, yes, 30 to 50% of childcare programs across the country could move to permanent closure. Childcare Aware of America just released a report just under 2 weeks ago called Picking Up the Pieces. And what we found is as of July 2020, 35% of childcare centers and 21% of family childcare programs remain closed nationwide. And this is in the context of prior to the pandemic, we already knew there were childcare deserts where families were unable to access quality, affordable, accessible care. So absent the help that providers need and the help that parents need, we're really going to be in a dire situation with not only a fractured system, but a shattered system of childcare.
I'd like to build on some of the comments that Dr. Fraga had made there. These childcare providers are engaging in truly Herculean efforts to try to keep children safe. And by that, I mean, I think I've mentioned before just the amount of effort that they're putting into, like literally the majority of them reporting disinfecting every surface and every fixture 3 times or more a day. I mean, can you imagine trying to do all of that and take care of children at the same time? And not just children under normal circumstances. These are children who are probably going to be more frightened and more stressed because their families are under more stress because of the conditions of the pandemic. You know, so I think we can't really overstate just how much these childcare providers are working to try to keep children safe. But we also ask them additional questions that aren't in the survey. We ask them about how confident are they that they would be able to have the supports and the supplies they need in order to be able to continue this. And 38% said that they weren't confident that they could even find the disinfectants that they would need. 47% said that they weren't confident that they could find the personal protective equipment that they might need. 37% felt that they weren't even sure that they could find somebody who could answer basic questions for them about COVID-19 and how to keep children safe. You know, many of these providers are struggling just to be able to find supports and to be able to find the supplies that they need in order to be able to continue to keep children safe. And one of the more touching findings that we found, again, one that's not in this particular paper, was that the child care providers who were doing all of this because they were continuing to go to work were more likely than the providers who were staying at home to also be wearing masks and to be social distancing and to be keeping themselves safe in their home life, pretty much in a way that would imply that they knew that they were going to be taking care of children who might be vulnerable. And so they were going to make sure that they themselves were safe so that they didn't bring it to the children in their care. We asked these providers, how worried are you? And 74% said that they were worried that they might bring COVID home to somebody that they live with. 77% said that they were worried that they themselves might get sick as a result of childcare. But 79% said that they were most worried about the children in their care. And I think that what these childcare providers were doing was they were showing us their worry by showing us all of the different things that they were doing to try to keep children safe during these conditions, both in these programs and in their own personal life. And that behooves us as a society and as communities to, one, not make their job even harder than it is by having community transmission rates at such a high level that they can't possibly win, and two, it's important for us to make sure that we provide them the support they need in order to succeed. The measure of how much we love our children is how much we support those who care for them. When we support childcare providers and give them what they need in order for them to be able to care for our children, that is a direct measure of how we as a society show our love and regard for the children that we have.
Wow, that's really powerful. Dr. Gilliam, the study also calls out the disproportionate effect of COVID-19 on people of color. Could you tell us a little bit more about what you found?
Yeah, that's now a very replicated study. We know that our citizens and neighbors of color are carrying a much heavier burden of COVID-19. And they're carrying that burden in addition to the burden of racism and a whole host of other societal ills as well. And we found that to be true too in our sample, that our Black, our Brown, and our Native American childcare providers were significantly more likely to have COVID-19. They were at a greater risk of developing COVID-19. But their risk for developing COVID-19 was unrelated to whether or not they went to childcare and worked in childcare or didn't. And so one of the things that I suppose is positive about this is that, at least in terms of like the childcare setting itself, it did not contribute to the disparities in race that we see in COVID-19. But there are certainly some kind of factors that are existing within the communities in which our childcare providers live that certainly do seem to be contributing to that.
And Dr. Fraga, what are you seeing in childcare providers? What are you recommending as a result of those findings?
So unfortunately, what we know is that first, childcare providers are a majority female, and majority of there's definitely an overrepresentation of, for example, women of color in the childcare community. And so as the childcare workforce. So as we're thinking about the childcare workforce and the disproportionate impact on persons of color and communities of color, we know and frankly are surprised by the disproportionate numbers that Dr. Gilliam just raised. And what we need to focus on then is, firstly, how do we ensure that this workforce is supported, paid, compensated, respected, and provided the kinds of health insurance and health coverage and access to paid leave and paid sick leave, the kinds of things that are necessary given the kinds of real risks that our providers are taking in order to provide care, that they do so lovingly and in such an amazing way. We need to ensure that our childcare workforce is given the respect, the compensation, the supports, the kinds of resources and materials and access that they need for their own care so that they can care for children and families. And unfortunately, we see a disproportionate negative impact in many ways for persons of color and for women of color. And so we want to ensure we're addressing those inequities.
And Dr. Fraga, here we are in October. It seems that it's cold and flu season is upon us, and numbers seem to be rising in many states. It sounds like a challenging environment for childcare providers. How do they balance it all?
It is a challenging time for providers. It's a challenging time for all of us. However, I think one piece of positive news that I think we just need to acknowledge is that our licensed childcare providers in many ways have prepared for this because licensed childcare providers have the health and safety training on infectious diseases prior to the pandemic. This is part of what they do, cold and flu season, and they're trained and supported in that way. Obviously, we have to multiply that in the context of a pandemic, but we also are trying to marry what we've learned about COVID-19 with this impending flu season. So we do have resources available on our own website about flu and COVID. And our childcare providers are also integrating that information. So encouraging, for example, flu shots, and making and educating parents and providers about the importance and necessity of all of the kinds of health and safety factors that were raised earlier: hand washing and social distancing and mask wearing and sanitizing and cleaning, educating, supporting, and making sure that as we move into the winter months, that we keep vigilant about all of these things, and we ensure that our providers are supported with the kind of access to resources that are needed. And again, can't say enough that in order for our childcare system to thrive and survive, frankly, through the pandemic, they do need support, they need equipment, they do need the kinds of resources that can ensure that they're able to put into practice that which they know to keep healthy and safe spaces for children and for their families.
Great. I know we only have a few more minutes, so I wanted to just go to each of you for any closing thoughts or anything that we haven't said that you'd like to summarize to the study, and to let our media know again that if you would like a more personal interview, please contact me in the chat or at wbattle@craftdc.com. Dr. Gilliam, your closing thoughts on the study.
Sure. There's a lot more that we need to know. I mean, it would be great to be able to have better contact tracing studies within childcare programs, to be able to have more data on exactly how does COVID move within childcare programs. But setting that aside, this right now is the best that we have, and it's an incredibly large sample of childcare providers from around the nation. And on the basis of the data that we have, there seems to be no relationship between whether these childcare providers were in a program or whether they were staying at home. But the core focus that we have to go back to is that we can't really take those findings outside of the context in which they were generated, which is that they were generated comparing childcare providers who were staying at home to childcare providers who were at the beginning of the pandemic doing some nearly Herculean things to keep children safe. Herculean things that they've all then at the same time reported they weren't sure that they were going to be able to continue doing. And so if we really want to be able to see our childcare programs and our schools to be able to stay open, this is the part of the finding that you can generalize to schools, then we need to be able to help them both be able to succeed. And that means reducing community spread as much as possible so that we don't stack the deck against these schools and childcare programs, and also making sure that they have access to the supplies and the supports that they need in order to be able to succeed.
Thank you. And Dr. Fraga.
Ditto to everything Dr. Gilliam just said. And in order to have access to supplies, in order to have access to the resources and supports that providers and parents need during such a stressful time and trying to take care of children and their care and to take care of their own children and make informed choices, we need to have an investment by Congress to support childcare system. I can't say it enough that if we do not take steps to invest in childcare and stabilize childcare with a $50 billion investment, we may be staring at a childcare system that is decimated, and we cannot recover absent childcare. We need to have spaces and places for children to thrive in a healthy way, and we need to have providers supported and resourced so that parents can have access to care and feel confident and comfortable that their children are safe and healthy.
Thank you. I'd like to point everyone to childcareaware.org/Yale to download an executive summary, access the full report, in addition to supplemental resources about how our child care resource and referral agencies can better understand and respond to the report's findings. In addition to policy recommendations that Dr. Fraga has outlined today. In addition, as I said, if you'd like additional interviews, please contact me, wbattle@craftdc.com. I'd like to thank Dr. Gilliam and Dr. Fraga and our media members who joined us today, and this concludes the conference. Thank you very much.